Hi, this is Dr. Justin here, and today's talk is on chronic pain. People that have structural issues, it hurts to move. What's the solution? Well, the first phase of treatment, we have to figure out why your body is in imbalance. What muscles are turned on and what muscles aren't turned on. So think of your muscles as like a natural shock absorber. If your body cannot absorb force properly, then force gets absorbed by sensitive structures such as discs, tendons, ligaments, bone, etc. So when you're driving down the road in your car, you have natural shock absorbers, or you have shock absorbers in that car that allow the car to absorb force. This allows for a nice smooth ride, and again, if those shocks weren't there, the force would be absorbed by sensitive tissues or sensitive structures in the car, such as the axle and under the hood parts as well. So the first thing we want to do is, if we have shock absorbers that are off various muscles in the hips, knees, ankles, force is going to get absorbed by sensitive structures in the body. And over time, we're going to develop an itis or an osis, and that's the last thing we want. Our conventional treatments tend to be a surgical procedure or cortisone injections. And all of these procedures only address symptoms and don't actually fix the underlying cause of the problem. So phase one, again, we want to assess why the body is not in balance. What muscles are turned on, what muscles are turned off. Once we have a starting point, that gives us the ability to then now perform various neurological and or chiropractic or soft tissue treatments to help push the body back into being neurologically balanced. The body is set to adapt. So all we are doing is providing the right force and the right stimulus to push the body back into balance. That's all it needs, is a little push. Pull the stressors away and give the push in the right direction to heal. Once the body is back into balance, we use specific bioelectric devices, such as when someone has a heart attack, we pull out a defibrillator to get that heart beating back on track. The same thing, we use specific bioelectric devices to act almost as a defibrillator to the various muscles and the joints that have been turned off for long periods of time. This allows us to get the muscles turned back on faster. It allows us to decrease pain, to decrease inflammation, and also to increase blood flow to the area to promote faster healing. When we combine phase one and phase two of care and add in an anti-inflammatory diet, we find our patients get better 80% faster than anyone else. I hope this information was beneficial. For any other questions, feel free and visit justinhealth.com and or call or email the office. Thanks. Have a great day.